checks every now and then, so make sure, get to your health checks, get an idea of what's going on, because heart disease and diabetes both are asymptomatic, meaning they often have no symptoms. So 800,000 Australians have been diagnosed with diabetes, and this was about 4 years ago, this presentation, I think. 85% of those people are actually type 2 diabetes. So that means late onset. The most preventable chronic disease that we have is type 2 diabetes, and it's purely diet and lifestyle, purely. So make sure you get your blood pressure checked. We come around and do blood pressure checks. You'll be getting them done on the 28th and 29th of September, so put your name down. This is just, you'll get these results when I give you your little slips from your blood pressure. 120/80 is what we aim for. 180/110, far too high. Cholesterol as well. So there are, it's basically cholesterol is a result of eating too much saturated fat. So you all know what saturated fats are. So your meat products, your dairy products, or your animal sort of foods. Trans fatty acids now are coming under attack as well. These are your palm oils and your coconut oils. So in your baked goods, sorry, not coconut, more palm. These are the cheap oils that they use in all your baked goods and pastries and pies and biscuits and cakes and those sort of things. Thought to be even a bigger problem now than saturated fat. So getting a nice blend of the two. So LDLs are your low density proteins. So low density meaning they float. So they float in the bloodstream, therefore they're able to stick to the vessel walls more readily. And these are also known as the bad cholesterol. So this is what causes arterial plaque. HDLs are high density, so they sink in the blood. HDLs are really good. This is your good cholesterol. They're really good for you because they actually transport fat. They transport the LDLs back to the liver, or actually they transport cholesterol back to the liver so it can be processed and gotten rid of or used. So I think the idea behind the diet, if you're wanting to lose weight, a low GI diet is best. So get rid of all your refined carbohydrates. Often you'll find that'll work fantastically. Cakes, biscuits, pastries, those sort of things. Increase protein. So, like we talked about testosterone and muscle mass, the more testosterone you have in the body, or the more muscle mass you have, the more testosterone you have, the more calories you burn. So, make sure you're getting enough protein in your diet. If you're in good health and you're feeling good, the Mediterranean diet is really the way to go. So, lots of bright coloured fruit and vegetables, fish 3 to 4 times a week, good quality nuts and seeds, so a handful of nuts and seeds a day, olive oil, preferably raw. And the Mediterranean diet as well is a glass of red wine, good quality red wine every night. So red wine or grapes have now the most potent antioxidant known as resveratrol, has found to be high in grapes. So this is where the red wine, the antioxidants, the effects of red wine come into it. So, but moderate. They've shown from 1 glass of wine a day for it to have very protective effects and high antioxidant effects, but more than 1 glass, actually you start to reduce the antioxidant effect. So, yeah, glass of good quality red wine, fish, lots of greens, lots of red coloured vegetables, and exercise. If you're trying to lose weight and you're not exercising, forget it. It's not going to happen. The risk factors. So family history, if you've got a family history of type 2 diabetes, then you're at high risk. Being overweight puts you at high risk, particularly a high waist circumference, and low physical activity, which is actually most people with a sedentary job. So these are the things that you have to be aware of and just, make time for exercise. 1 in 5 men are obese. And there's a big link with diabetes and heart disease and erectile problems. So we don't have time today to go into that, but we might do a follow-up seminar. So healthy lifestyle, well, these are just, basic recommendations. But yeah, have a look at the Mediterranean diet, and if you're wanting to lose weight, look at low GI and increasing your protein and limiting all those trans fatty acids. So I'll let you go. You've been a wonderful audience.
Oh, thank you.
Thank you for coming. Any questions, don't hesitate, send me an email, and I'll shoot off an email with those organisations on them.